Bill Walton, over the years, being probably the biggest UCLA fan in the East Coast, big Bruin fan. I always said, especially during your NBA career, what if Bill Walton had remained healthy, pain-free? And I remember going back to, I think it was your senior year. Did it all start, the chronic back pain? You're playing Washington State. It's 2 weeks before the famed shootout against Notre Dame, where your team has the 88-game winning streak, longest in college basketball. A player in a dirty play undercuts you. You go down. And then the media doesn't really know that Bill Walton, for 2 weeks, out a couple of games before the big one, has a couple of small fractures in his back. Is this where it all started, Bill?
Gary, it's not what could have been. It's what can be in the future. And it was a long time ago. I broke my back January 7th, 1974.
Washington State. At
Washington State, I was low-bridged in a game, and it was a terrible fall. There was a dirty play of violence and viciousness, but that's the risk we all take every time we walk out there. I lived with back pain for 35 years, but now I've been saved.
That was the initial start of it. That one moment.
I lived with back pain ever since, and I just thought that was part of life. I also have structural congenital defects in my feet that I thought everybody's feet hurt all the time. I hurt my knee and had to have my first operation when I was 14, and I just thought everybody's knee hurt all the time. That's just the way life was. You do what you can until you can't do it anymore. And with all my orthopedic problems, I've had 37 orthopedic surgeries, I always waited too long. And I have both my ankles are fused, I have a new knee, and I have a new spine. And I'm doing fantastic now. So I'm just out ringing the chimes of freedom. I'm the luckiest guy in the world.
Well, and that's why you're here. XLIF is something that you really swear by. You're an ambassador for this. You had surgery, 4 or 5 years ago?
5 years ago and 3 months. And Dr. DiSimone and his staff, in conjunction with all the other doctors around this great country of ours, in conjunction with NuVasive and the medical device companies that are driving this technological technique and procedures and products revolution in the world that are giving people like me a chance. Spine pain, back pain, that's the toughest thing I've ever done in my life. But I have no pain, I take no medication, I had no idea what life was like without back pain. I lived with it for 35 years, and now it's all gone.
What are you doing now that you couldn't do before since you've gotten involved with XLIF?
I do everything, Gary. And I go everywhere and I do everything I want to. My orthopedic problems are limited to my feet because the ankle fusions, which keep me from moving around, but spine health is different than anything else. It's something that requires attention to detail every day for the rest of your life. But it's the choices of proper health, lifestyle, and doing things that are going to put you in a position to have the greatest chance of success. My outcome has been phenomenal.
It's amazing. Today, we plugged this on the radio, and I'm pulling into the parking lot. Guy that I know that from high school follows me in, Bill Walton fan. He says, I heard this amazing story about this new
it's a pioneering surgical technique, and the equipment and the technology and all the different things that the medical device companies are coming up in conjunction with the surgeons. They work together. This is about a team effort. This is not just one surgeon, one patient. This is everybody trying to make a difference and trying to give people our lives back.
And here's a guy that had hope, Dr. DiSimone, and you've been doing this since 2009 here. And he said, I've got to hear more. I said, I've got the pamphlet. I'll give it to you. We're going to have this on the website. And tell me more. You got involved. You met Bill Walton, and the rest is history. And now people are feeling like Bill Walton feels like $1 million after all these years.
Had the pleasure to meet Bill for the first time several years ago, but had dinner with him in New Orleans last fall. He is a patient ambassador for the Better Way Back program, which is for XLIF spine patients. And XLIF is a surgical approach, and it's a minimally invasive spine technique to decompress nerves, stabilize spinal segments, and relieve pressure on nerves so that your leg pain goes away.
You actually go through the side, right?
Go through the side through a 4-centimeter incision, what used to be what we call a shark bite from the midline in the front to almost the midline in the back. Now 4 centimeters gets you down there, gets the job done. So you're not violating a lot of tissue. That makes recovery a little bit nicer for patients, understanding that this is a big surgical procedure. This through the side is really the front of the spine. There's usually another piece to that. There's a decompression. Bill's analogy today is he felt like he got run over by an 18-wheeler after surgery. But he did recover from that, and he's doing wonderfully today. He's riding his bike. He does fundraisers. He rides 750 miles over a week to raise funds for handicapped athletes. This is as a result of having had this technique in spine surgery.
The minimally invasive surgical techniques that Dr. DiSimone is using today, I mean, that is the future, because the reduced risk of infection, the reduced loss of blood, the reduced hospitalization, the reduced costs, all the things that devastate you in spine surgery. And this is big, tough, really hard stuff that takes incredible resources to do. But now it's all just moving forward at light speed. And we as patients, we are the incredible beneficiaries of this, because now we get our lives back and we can live without pain, live without medication that allows us to think, to dream, to hope, to eat, to sleep, to have a life. I'm the luckiest guy in the world.
And the amazing thing is, you tell this story to folks, and then you see them have this procedure done, and you see the success stories that Bill has. You've talked to so many people, and here you are, right here in Central PA.
For this program today, we also had patient ambassadors, our own patients from Susquehanna Health that have had this procedure, that have elected to come forward to speak to prospective patients today, to talk about their fears, to talk about what it was like preoperatively for them, how much they improved postoperatively, how they got things in their life back after the surgery was done. So this has been a very powerful forum, having those patient ambassadors, having the patient ambassador sitting to my left, who was a great coach for them, and talking about his experience as well. It's been superb.
I never talked to one person prior to my surgery who had anything good to say about spine surgery. Most people who get better, the last place they want to come back to is the hospital. They want to get out and get going in life because it's taken away so much. But with the privilege that I have, the good fortune, because of the sacrifice of people like Dr. DiSimone, I have a chance. But with that privilege and chance comes responsibility, duty, and obligation to ring the chimes of freedom, to let other people know that there is a better way back.
So you're the coach, and you knew I was going to talk about the coach, a guy that influenced you so much, and a man that I'm a big fan of. Your coach, John Wooden, had a chance to meet and interview in '06 when he was just shy of his 96th birthday. And you just had the feeling you were with greatness. You were a guy that you were a free-spirited guy at UCLA. You wanted to grow the hair long in the off-season and all of that. I know, mine's going too. But the bottom line is, John Wooden, when did you and John Wooden connect, that he inspired you, that the two of you that were so different, a guy from the Midwest, guy from San Diego, and all of a sudden, the guy that leads his team to 230-0 seasons, you come together as one over those many, many years after you played?
I grew up in a culture of people looking at the world and saying, we can do better than this. And I'm going to do something about it. That was my parents. That was my first coach. That was my early teachers. That was Chick Hearn, the broadcaster for the Lakers, and that was John Wooden. It was also my musical heroes and icons, Bob Dylan, Jerry Garcia, Neil Young, the Beatles, the Stones, Carlos, Springsteen, all these guys, Crosby, Stills, and Nash, of let's get it done. And that's really what Dr. DiSimone, that's what Nuvasive, that's what XLIF is all about, is that spine surgery was not that successful over the years because of the huge infection rates with the massive shark bite cuts and the tough, gigantic open wounds that would just make all kinds of problems. But the technology that has changed all of our lives through communication, through science, through engineering. That has definitely affected and impacted the medical profession as well, no more so than spine. And so now it's happening, and here was Coach Wooden, who gave up his life so that other people's dreams could come true. Coach Wooden was a kind, gentle, loving, warm, sharing, happy man. And his happiness came from seeing other people succeed, particularly when it was in a team concept and there was acknowledgement to the help that was provided along the way. And that's really the same story. There are lots of Coach Woodens out there. Dr. DiSimone, my spine surgeon, people working in fire departments, people working in libraries.
Bill Walton.
But they're just,
Another Coach Wooden.
they're not self-promoters. And John Wooden was not a self-promoter. Coach Wooden was into making a difference, making a positive contribution to the team that he was a part of. And he loved the joyful optimism of sports and academics and being part of a team and his family and life and love. And all that stuff evaporates when you're lying on that floor in pain. And that's what we're all about with the Better Way Back program. That's what Dr. DiSimone does every single day. Susquehanna Health, their ability to give people their life back, to turn the light on, to take the pain away, to allow you to move away from the medication that just destroys your life, to enable you to hug your wife, to enable you to think that, man, we can go do something tomorrow. And tomorrow is going to be a sunny day with nice breezes and birds and the Susquehanna River coming right down through. I'm the luckiest guy in the world.
You got to feel great because you played with all that pain, and
it's all gone now.
And it's gone. I read when Coach Wooden and all the players are going to see him those last days, and you had said your goodbyes. Right. That it was tough for you to be there that last night because you were in bed with this incredible back pain.
Yeah, it was very, very tough. And in the world of challenges, you do what you can, you figure it out and you get the job done. But no one can beat that overwhelming, debilitating, excruciating, unrelenting nerve pain that just takes you down. It's not a matter of being tough. It's not a matter of trying. You know, these doctors, they have to get inside of you. And the great thing about XLIF and NuVasive and the minimally invasive surgeries is that they're poking small holes in your body.
Right.
And then they're able to go in with this incredibly complex technological equipment and get inside and be able to do all the work that they used to have to cut your whole body open with to get in there. And now it's just fantastic. Some people, every case is different, and never compare your injury to somebody else's. But some people just walk in and they're done and they go home and they're right back to it. One of my big problems, I'm so stubborn, you probably had a hard time figuring that out. I'm so stubborn that I waited too long.
To that point, if I can interrupt, and he's the first to say that he waited too long. He played how many years in the NBA with back pain and leg pain? He did conservative treatment for 30 years before Bill decided that it was time. So, but the real message here is that 90% of patients with this kind of problem get better with conservative care. Bill was not one of those. The message is do the conservative care, and at Susquehanna Health we have all of that. We have the physical therapy, the pain management, the medications to try and get you through those therapy and pain management regimens. If you don't respond, okay, you have this as an option. But 90% get better without surgery. For the unfortunate 10% that have the appropriate things wrong with them, we can fix them, and we have techniques and the latest to do that.
The great thing about Dr. DiSimone is that he's like John Wooden. He heals you, he teaches you, he shows you the direction of where you need to go, but then you have to do the work. And as I come in here to Williamsport and I see this beautiful valley and the river just coming right through and the trees and the mountains and the clouds and everything just perfect. And then here at Susquehanna Health, when you've got this remarkable facility with every possible option to try to get better. And now, soon we're going to have a brand new YMCA right across the street.
That's
because
right.
there's nothing more important than exercise, the team, and listening to the music play.
State of the art.
That's my medicine.
World-class facility. You have it here.
Absolutely.
I know we're about ready to run. We could talk all day about some of the great games in basketball. I have a question for you. You mentioned music, and I know you have. How many Grateful Dead concerts have you seen in your life?
Not enough.
And the next question, coming from your son Luke through our buddy Roy, he said, ask my dad how many Springsteen concerts he's paid to go see.
I'm the luckiest guy in the world, Gary, in that I had heroes when I was a child. I still have heroes today, Dr. DiSimone, and all the people who give up their lives so that people like me can have a dream. But growing up, I had all these heroes. In sports, it was Bill Russell and Muhammad Ali. In music, it was Jerry Garcia and Bob Dylan and Neil Young and John Lennon and John Fogerty and all these different people, Springsteen, Crosby, Stills and Nash, Carlos Santana. I got to meet all these people. And like Dr. DiSimone, like John Wooden, these guys were all better people than I dreamed of them. And imagine in your life when you think something is really fantastic and really great, and then it's better than that. And that's my experience with my spine, in that I had no idea. I had lived with it for so long, and now I can just feel it, and it just feels so good. And I just like wake up and I say, oh my gosh, I can go all day. I can ride my bike all day. I can get up and walk and
I don't know how you
and
did it
dream
all these years. And all those years of coming out of playing for the Bruins and then that run in the NBA. I know we're about ready to have to run, but boy,
you just think that that's the way it is.
Yeah.
And that's what is so frustrating about waiting too long, is that you learn that that's not the way it is, and you learn that you don't have pain. And the ability to think, the ability to dream, the ability to plan, the ability to build and lift and grow. And when you have that pain, none of that is there. None of it's available. And it's like, I walked into this beautiful hospital today, and I got off the elevator, and there was this fantastic mural of John Lennon.
That's right.
Whose song, Imagine. So when you're sitting there and you're lying in agony and it's just overwhelming and your whole life is falling apart, imagine what it would be like if it didn't hurt, if it wasn't like this. This guy, he gives you the chance that that's going to happen.
It sounds like it's better than a 30-0 season, all it is.
This has been the hardest thing of my life. It's also the best.
Bill Walton, I want to thank you. Of course, big hero. You're one of mine. A big Bruin fan over the years. It's a real pleasure and honor to meet you here, Dr. DiSimone. A hero here in our community with something that is new. It's state of the art. It's given more people a chance to feel the way Bill Walton now feels. So much hope, and that's what this is all about.
You're too kind, Gary. Thank you.
Think of it in terms of the pioneers. Think of Steve Jobs, who taught us that everything is really hard until it's easy, once you do it. And it's like my piano teacher. And so now these guys who just drift and dream and figure things out over the course of their lives, and then it gets to this level, and it's evolving every single day, and it just keeps going, but it's not easy. It's not easy for us. He gets in there, he does his job, but the rest, as Coach Wooden said, the rest is up to you.
Bill Walton, Dr. DiSimone, thanks
you.
again. It has been my pleasure to be here at Susquehanna Health and talk about XLIF, something great from our community. Thanks again.
Thank you.